What we do here matters, because what we don't do matters even more.
We need to continue to push, and we at ADAO are going to continue to push the Surgeon General of the United States.
As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use.
The most horrific part of this whole story is that it is preventable.
Hello everyone, my name is John Thayer, and I was the supervisor for 10 steam fitters who provided utilities to all the federal buildings on Capitol Hill. I realize some of you attended the Capitol walkthrough yesterday. It's beautiful, isn't it? But don't let that give you that false scenery let you leave here today with a positive attitude towards Capitol Hill. Because what exists under the buildings are a complex of hazards and asbestos piping, life-threatening tunnels laden with asbestos piping which will never be seen by the public. We were forced to work in an environment that had 160-degree temperatures, asbestos so thick you could write your name in it, as well as no escape routes, as all grates were locked from the outside. Huge sections of concrete would fall on top of the steam pipes, and were well documented in a study that tunnel personnel were subject to serious injuries and or death. After years and years of submittals by myself to get money to fix some of these issues and repeated denials of any funding to correct any of these problems, and hearing from my superiors, well, if no one can see it, then why should we appropriate any money? As a supervisor, I spent a good amount of my time watching my men getting sick and finally said enough is enough. As we brought these illnesses to light and forward, and I asked for evaluations of all my employees' health, which we were denied, we were forced to go out on our own at our own expense, where we ended up in Detroit, Michigan, under the care of Dr. Michael Harbert, one of the foremost doctors in occupational diseases, and the Caregivers Cancer Center in Detroit. All 10 of us were diagnosed with severe cases of asbestosis, kidney, liver, heart, and other numerous diseases. After we reported our illnesses to the architect of the Capitol, we were immediately blackballed. Capitol Hill Damage Control Center was opened up for business. The very first reading that they ever took of the tunnels to try to disprove us, the air sample was 30 times over the legal limit. I've worked down there for 25 years. Scott Smith, who's here today, was one of the guys who worked for me, was subjected to those. Okay, but the excessive readings was not enough to concern the people on Capitol Hill. Their concern instead was us being on NBC Nightly News, the various newspapers, the Senate hearings, etc. Not the health and welfare of the tunnel workers or their families. We considered ourselves damaged, expendable goods. Priority number one for them was keeping this a secret. Little did I know that our concerns for our safety and health damages when we begun this would be met with such aggression. Our only recourse at the time was to try and save our jobs to support our families, which we were threatened with. The end result, we were all let go with a minute take it or leave it settlement for harassment and retaliation. The only problem is we're all gone, and we are now most all unemployed, some without health insurance, and still left with the existing health problems that our employer gave us because of their refusal to make safe working environment for the employees. Over the next couple of years, since I've been gone, and after numerous broken promises from some of the highest ranking senators and congressmen on Capitol Hill, and Linda's been part of that, to hold the architect of the Capitol responsible for what one high-ranking senator said in a public hearing, that the architect created criminal liability, as well as putting our group, they wanted to try to put our group under lifetime medical. None of this has ever happened. The one thing I do call for on Capitol Hill, besides banning asbestos, is complete removal of all the existing asbestos, since they are clearly incapable of maintaining it safely and holding that responsibility. As there are others who continue to have the same problems we have had, but saw that we all lost our jobs, so feel sometimes it's better not to say anything at all. We continue to struggle with our illnesses, as well as one of the wives who was recently diagnosed. She was a homemaker, never worked outside the home. She's been diagnosed with asbestosis since and is now in a wheelchair. I would like to see some laws change, because federal workers should have the right to sue and be compensated for personal injuries obtained on the jobs, especially when somebody else is responsible for that. Currently, that does not exist, and in case you are asking, workman's comp does not take asbestos-related diseases unless it is accepted by the employer. In other words, what Capitol Hill has to do in order for us to receive that is to accept responsibility, which is never going to happen. In closing, I'd like to thank the ADAO and Linda and Doug for all their compassion towards myself, my families, and all of the other tunnel workers, and my wife, Vicki. Thank you. And that's it.